Welcome to the Healthcare Scene After Party. We may or may not post this depending on what the questions are asked. So it may live in infamy on Blab, or it may go to YouTube. So if anyone watching live wants to hop on, you can click the open seat and we can add you. I know Sean San was trying to join, but if you have any questions for our panelists, certainly welcome you to join. You can add the questions with /Q. If not, we'll end the party and we'll head off into the snowbound sunset for Beth, right?
We can collaborate on the design of Beth Justice's avatar. It's going to have two capes, because there have to be duplicate capes.
She's going to have duplicate symbols across the chest.
Yes, with a big X mark.
Two patients going. That's great. Well, I think it was a great discussion. I think people don't realize the magnitude of the problem. I think most consumers don't realize that. And, I think Michael brought up an interesting point at the end that a lot of the organizations are in denial, probably, almost like HIPAA security, right? They're, oh yeah, we're secure, we're HIPAA secure, we've filled out, we've done the risk assessment, we must be secure, right? And it's like, well, given the breaches, if Google could be hacked, you could too, right? And in fact, if you think you are, if you think you're secure, you're probably not. You've probably been hacked already, which kind of goes back to your point, right? I think it was Beth said, if you're at 2%, you probably are, just in a little bit of denial.
Yeah, exactly.
Yeah. Definitely. And, I think if you look again at the 2014 ONC report on patient ID, that report was all about recommending prevention of the creation of duplicate medical records. And I think that in terms of data security, they should really kind of take that same kind of concept and apply that, because you're right. I mean, you don't want to wait, especially with the PR fallout that comes with any kind of data breach. You don't want to wait to address the problem after the fact.
I totally agree. And I think that, one of the things that happens with us, and it's, it's a sad commentary on our industry, is that, sometimes we get called in because they got sued. And so now they go, oh boy, now we better fix our problem. And, and we've got a pretty comprehensive, list of cleanup and consulting services that can help you from many, many different angles in not only fixing the problem, but helping, as Michael said, to prevent it. But it's always sad when that happens, when we get hired because they got sued.
Absolutely.
It's interesting you say that.
Go ahead, Mike. I was going to just share a anecdotal story. As John, you were talking about you and your wife earlier, and how, obviously there's things like medication allergies to be aware of that can affect the evaluation process. My mom recently, this just happened recently, she went to have a visit with her primary care physician, and her doctor was looking at her medical record, and she said, did you go and visit somebody else recently for something related to lung cancer? And there were all of these notes on her chart related to lung cancer. Now, my mom has a lot of, she's got a lot of health concerns, no question, but she definitely does not have lung cancer. Yeah. And what's really interesting about this is that the erroneous information about this that was on her record was put in there from another healthcare provider that was not even part of the health system that her primary care physician was under, which means that most likely they were maybe in an HIE or something like that. Somehow the information was shared and got put on her record from an outside healthcare provider. So I think, those kind of, and all of us probably have stories, like that. And those are the things that really, I think, make it resonate, throughout the marketplace.
Right. No doubt. Yeah, and it was interesting. I was on a bus with I think Jerry Just is your partner in crime there, right?
Yep.
Just Associates. I was on a bus with him at some event in Florida. I can't remember. We go to so many, right? But I was on a bus with him, and I'd known him for a few years. We'd met over the years at different events and talked about this problem. And being the cynical blogger that I am, which I think some people would call me cynical. I think I'm an optimist, but a realist. But anyways, being the cynical blogger, I think I said to him at one point, I said, "Hey, well, isn't it great for your business that these people keep having the problem? Then they have to keep bringing you in, right? Like, I mean, because they're just so bad at the processes, right? They haven't implemented Michael's solutions. You say it like that. They haven't implemented them, so keeps coming a problem. It's almost cyclical, like, we just got to hire you every year to 2 years because we're bad at doing this. And so, his response was really insightful for me because it says something about him and your company. Because I said it very cynical, like it's great for business, And he looked at me, he's like, "John," he said, "No," he said, "there's plenty of business because people keep acquiring each other and all of that." He said, "We don't want to be brought in over and over again." He said, "We'd rather be brought in, fix your problem up front with patient matching, and then help you develop a solution so that you don't bring us back in again," which, credit Jerry to that. His heart's in the right place. I think he probably understands, kind of the stories that Michael shared, and I shared, that those things matter, and we should really fix this problem as permanently as possible, and not just, create a company built on the fact that humans are frail and we make mistakes. So.
Yeah, well, I know that is our sentiment, and we have lots and lots of customers that they keep acquiring more organizations, and organizations are getting bigger, and they just call us. I mean, they don't call anybody else. They're bringing another hospital in. Well, call Just. So that's the kind of business we want. We want to be helpful and helping them with their data migration processes. So again, when they're migrating that data, they don't dump in a bunch of data that's dirty, as well as not mapped properly to their existing EHR or whatever. So those are the kinds of solutions that we're services that we're really trying to promote in the industry.
Yeah. Oh, that's excellent. Well, it's such a massive problem, such an important problem you guys are both working on. So, and I know the amazing part, I love that Beth shared 12 years ago, they did a study that it was a problem. It shows you how long you've been working on the problem. Michael started his company 13 years ago, which I didn't even realize they'd been around that long, and been working on the problem. So you guys have some great insights. Joe, it looks like he's afraid to hop online, but he asked a question. Let's see. How often should providers audit their medical records to assess duplicates and other issues? Seems like Beth is probably the one for this question.
That's right in Beth's wheelhouse.
Yeah. Well, that's a good question. I guess it just depends on what kind of technology you have in place. I mean, you shouldn't have to go and audit, right? You should be able to just constantly, every day, be preventing and then catching quickly the ones that ultimately are going to, you will always create a duplicate. John Does are going to prevent you from having perfect records. And with no duplicates at all. But even a biometric would even help with that. Because if the patient was in the system, right? If their facial recognition was in the system, or some other type of biometric signal, but there's always going to be the exception. The guy's in a really bad car accident and his face is all banged up. Well, it might be a little hard to do facial recognition then. So, you should be constantly doing it, but short of having the good technology tools in place, then, you should be auditing and assessing it at least once a year. I mean, Nordstrom's and, the Land's End and those big types of retail companies, they scrub their data every 1 to 2 years. And they do it just so that they don't send duplicate catalogs to the same customer. They're doing it for strictly financial reasons, to save themselves money on sending, catalogs out. So why wouldn't healthcare do that?
It's interesting to look at the retail and that they're willing to do it, and we're in healthcare we're like, it's like we're almost afraid to admit that we have a problem. I guess in some cases, But is every day reasonable? I mean, do you see organizations doing it every day, or what do you see more often? I mean, or is it more like a weekly thing, or I mean, what do you see across organizations?
We don't see them doing it at all. I mean, we see them going in and doing a cleanup, and then nothing. Wow. They might hire a few data stewards to back end catch whatever they catch. And there are organizations out there that are absolutely spectacular at that. But again, they're dependent on the technology that they've got to be able to identify the duplicate. So
they need better algorithms.
If they use only, the EHR's duplicate record matching algorithm, they're going to miss a lot of real duplicates.
There was a report that came out recently from AHIMA, and I was just pulling it up on our blog. It's on the Right Patient blog if anybody's interested. But they polled a bunch of HIM professionals, and 73% of them reported that they work duplicates at a minimum of weekly. 47% of respondents stated that they that they lack a quality assurance step in their registration or post-registration process. So, it's a big problem. It's an ongoing problem, no question. The consultancy services that Beth provides, there's going to be a huge market for that for a long time, forever. Even for organizations that have technology like Right Patient in place. But the other thing I wanted to mention is that we actually had a case study from one of our customers, Novant Health, and this kind of illustrates the John Doe issue that Beth mentioned, and how a biometric solution can help to resolve that problem. So they had a situation where a patient came into the ED. She was incoherent. She had no identification on her. She couldn't provide any information about herself. They took her picture with our camera. The camera uses the iris pattern to authenticate the patient, and they were able to identify her and pull up her medical record. And at that point, they can contact her family, her husband. I mean, there's obviously a patient safety aspect to this. There is a cost aspect to the provider. But I mean, just practically, you think about the impact that something like that can have on a person's life. And that's another reason why we feel that, this really needs to have serious attention given to it, because all of us are patients at the end of the day. And, we never want to be in that kind of situation where we can't have a loved one be notified that you're in trouble and you're in the emergency room because they have no way to identify you.
And certainly the pediatric patients are the biggest concern, because they can't even advocate for themselves. I mean, yes, as adults, we can go in and, certainly sometimes we're unconscious, but most of the time we can at least say, I've been here before, why don't you have my record? Right. But the pediatric patients can't, and they don't have anybody to advocate for them. And so we just have to do a much better job than we've done, and realize the person impact that it has on each and every one of us. And I always say, if that were your kid, how would you feel? I just talked to an organization that is, they're getting rid of the baby records. They don't consider them duplicates. Like, what? They're just going to take them out of their duplicate queue. It's like there's still a lot of organizations out there with a lot of misconceptions on how to handle the problem and what the problem really is. And
Yeah. Well, I think that's the perfect way to end this, the human element, right? In healthcare, we work on such an important problem. And sometimes we get so stuck in the tech, the bureaucracy, the financials, that it's important to remember the human element as well. Mm-hmm. So thank you so much, Michael from Right Patient, and Beth Just from Just Associates. Thanks for joining.
Thank you.
Thank you for having me.